Hi, my name is Dennis Tomas, and welcome to my presentation on psychotherapy. For the patient I'm utilizing is a 36-year-old married woman who states she has anxiety and depression related to degrading relationships with her husband and mother. She states that everything used to be perfect, but things have gotten worse over the last couple of years, leading to near constant fighting with both of them. She displays a lot of anger with both her mother and her husband, lots of depression related to the situation, but is also very, very fearful of losing the relationships with either of them as she cares for them both very, very deeply. Um, we'll utilize three different psychotherapy methods to assist with this patient. The first one being a person centered therapy, which allows the patient to do most of the talking and lead the conversation. I think this would be beneficial to begin off, just to get not only acquire more information from the patient, but allow them to do most of the talking and see how many of their issues they can work through initially on their own. It is known as Rogerian therapy after the pioneer of psychology, Carl Rogers, who first utilized the method. He thought that everyone was different and saw the world differently, and they could manage their world if they knew how to find the best solutions to their problems. It relies on three principles. The therapist displays an unconditional positive regard, which means the therapist must be empathetic and non judgmental, and build a relationship of trust and confidence with the patient. It also uses empathetic understanding, which means that therapists are non judgmental of thoughts and feelings, and also congruence, which means the therapists maintain the same level as a patient without displaying authority or any superiority in any way, leaving them in an even relationship. The second psychotherapy method we will utilize is Albert Ellis's ABC model, which is a part of current cognitive behavioral therapy, although it was part of his rationale emotive behavioral therapy, which precedes cognitive behavioral therapy developed by Beck. And the ABC model is just now currently used in many of the CBT interventions, which have encompassed it, and adding many more. It utilizes a five-step process, often called ABCDE, which is activating event. It's usually some kind of triggering event that the patient goes into detail about, and then it goes into the belief that the patient has about that event, sometimes rational, sometimes irrational. The consequence, which is a lot of the negative consequences associated with that belief, whether it be a rational or an irrational one. The rational one usually leading to a healthy consequence, while the irrational one usually leading to an unhealthy one. D is disputation. This involves the therapist. It usually the therapist makes a conversation point and will dispute a lot of the rational thoughts that a patient has about any of their beliefs in regards to the activating event. Hopefully changing a lot of the patient's beliefs from irrational ones to rational ones. And then the new effect, stage E, uh, which is when the irrational belief turns into a rational one, and the patient has healthier consequences as a result of the belief change. The third psychotherapy intervention that we will utilize is emotionally focused therapy. This allows the patient to build back these relationships with their mother and husband. I believe it's a good third one to utilize after she works on herself a little bit. She works on the actions that are causing this degradation in relationships between her loved ones, and then to work to build those relationships back up. This type of therapy focuses on developing the bonds in adult relationships, and this will work with the therapist attempting to discover deeper connections that the patient may have forgotten about with her mother and husband, and new ways to listen and to communicate will be explored as well. There's three stages to this therapy. First is to de-escalate the current negative cycle of emotions. Next, the patient will try to change the way they interact by expressing their concerns with their loved ones without pushing them away. And Next is the stage of preventative care, where a therapist will attempt to show the patient where these negative patterns occur and how to prevent them in the future. So, utilizing these three therapies, it allows the patient to think about themselves a little bit and also express all their emotions and get it all out. The second part, the rationale motive behavioral therapy, will attempt to look at the way the patient views these situations and hopefully change them from irrational ones to rational ones, having better consequences to these situations. And then the third one will try to build these relationships back up from the point they're currently at, so she won't have a fear of losing them anymore.